Social anxiety disorder. Feelings of shyness or discomfort in certain situations aren't necessarily signs of social anxiety disorder, particularly in children. Comfort levels in social situations vary depending on personality traits and life experiences. Some people are naturally reserved and others are more outgoing. In contrast to everyday nervousness, signs and symptoms of social anxiety disorder can include persistent fear of situations in which you may be judged, worrying about embarrassing or humiliating yourself, intense fear of interacting or talking with strangers, fears that others will notice that you look anxious, fear of physical symptoms that may cause you embarrassment, such as blushing, sweating, trembling, or having a shaky voice, avoiding doing things or speaking to people out of fear or embarrassment, avoiding situations where you might be the center of attention, having anxiety in anticipation of a feared activity or event, enduring a social situation with intense fear or anxiety, spending time after a social situation analyzing your performance and identifying your flaws in your interactions, expecting the worst possible consequences from a negative experience during a social situation. Physical signs and symptoms can sometimes accompany social anxiety disorder and may include blushing, fast heartbeat, trembling, sweating, upset stomach or nausea, trouble catching your breath, dizziness or lightheadedness, feeling that your mind has gone blank, and muscle tension. Avoiding common social situations. Common everyday experiences that may be hard to endure when you have social anxiety disorder include, for example, interacting with familiar people or strangers, attending parties or social gatherings, going to work or school, starting conversations, making eye contact, dating, entering a room in which people are already seated, returning items to a store, eating in front of others, using a public restroom. Social anxiety disorder symptoms can change over time. They may flare up if you're facing a lot of stress or demands. Although avoiding situations that produce anxiety may make you feel better in the short term, your anxiety is likely to continue over the long term if you don't get treatment. Causes. Like many other mental health conditions, social anxiety disorder likely arises from a complex interaction of biological and environmental factors. Possible causes include inherited traits. Anxiety disorders tend to run in families. However, it isn't entirely clear how much of this may be due to genetics and how much is due to learned behavior. Brain structure. A structure in the brain called the amygdala may play a role in controlling the fear response. People who have an overactive amygdala may have a heightened fear response, causing increased anxiety in social situations. Environment. Social anxiety disorder may be a learned behavior. Some people may develop the condition after an unpleasant or embarrassing social situation. Also, there may be an association between social anxiety disorder and parents who either model anxious behavior in social situations or are more controlling or overprotective of their children. Risk factors. Several factors can increase the risk of developing social anxiety disorder, including family history. You're more likely to develop social anxiety disorder if your biological parents or siblings have the condition. Negative experiences. Children who experience teasing, bullying, rejection, ridicule, or humiliation may be more prone to social anxiety disorder. In addition, other negative events in life, such as family conflict, trauma, or abuse, may be associated with social anxiety disorder. Temperament. Children who are shy, timid, withdrawn, or restrained when facing new situations or people may be at a greater risk. New social or work demands. Social anxiety disorder symptoms typically start in the teenage years, but meeting new people, giving a speech in public, or making an important work presentation may trigger symptoms for the first time. Having an appearance or condition that draws attention. For example, facial disfigurement, stuttering, or tremors due to Parkinson's disease can increase feelings of self-consciousness and may trigger social anxiety disorder in some people. Complications. Left untreated, social anxiety disorder can run your life. Anxieties can interfere with work, school, relationships, or enjoyment of life. Social anxiety disorder can cause low self-esteem, trouble being assertive, negative self-talk, hypersensitivity to criticism, poor social skills, isolation and difficult social relationships, low academic and employment achievement, substance abuse such as drinking too much alcohol, suicide or suicide attempts. Other anxiety disorders and certain other mental health disorders, particularly major depressive disorder and substance abuse problems, often occur with social anxiety disorder. Prevention. There's no way to predict what will cause someone to develop an anxiety disorder, but you can take steps to reduce the impact of symptoms if you're anxious. Get help early. Anxiety, like many other mental health conditions, can be harder to treat if you wait. Keep a journal. Keeping track of your personal life can help you and your mental health professional identify what's causing you stress and what seems to help you feel better. Prioritize issues in your life. You can reduce anxiety by carefully managing your time and energy. Make sure that you spend time doing things you enjoy. Avoid unhealthy substance use. Alcohol and drug use, and even caffeine or nicotine, can cause or worsen anxiety. If you're addicted to any of these substances, quitting can make you anxious. If you can't quit on your own, see your doctor or find a treatment program or support group to help you.